This week, the World Health Organization has declared mpox in Africa to be a global health emergency. Now, that is the highest alarm level the organization can issue. A deadlier strain of the virus has appeared in 4 previously unaffected countries and is rapidly spreading in the Democratic Republic of Congo. The chair of the WHO's Emergency Committee says the situation in Africa is just the tip of the iceberg. Mpox can spread through close contact, like kissing or sex, and initial symptoms are very similar to having the flu. They include fever, chills, exhaustion, headaches, and muscle weakness. So for more on Mpox and the emergency that it's bringing, including here in Canada, we are joined now by Dr. Joanne Liu. She's a professor at McGill University School of Population and Global Health and director of the Pandemic and Health Emergency Readiness Lab. Dr. Liu, very good to have you on the show. Thank you for making time for us.
Thank you.
Dr. Liu, just this week, you and 2 colleagues wrote this very compelling op-ed in the Globe and Mail, essentially asking Canada to step up in this global emergency. What are you all asking Canada to do?
Well, basically what we are asking Canada is to do its part and step up to the plate of equity, vaccine equity. We know that most likely the estimated amount of vaccine that we have in Canada for mpox is around 10 million doses. And so can Canada consider to share some of those doses with the countries in Africa that are affected?
And why specifically Canada?
Well, I think that everybody should step up to the plate. But I think that through COVID-19, Canada has been labeled as the hoarding country of the world, where we had an average of about 5 doses of vaccine per Canadian. So I think that we could afford to share some of what we have, and we could help as well African countries for procurement and support them in that process. And I think that is a very, I would say, simple things to do, and it's something that Canadians will be proud to do as well.
Give us the stakes of this, because someone could turn around and argue, hey, we need these vaccines, we need to protect our own population. But in your op-ed, you're clarifying that this is a very serious strain and that the situation is inevitably going to affect Canadians as well. So talk us through that whole argument.
So basically, what is interesting is a big game changer, because mpox has been existing and then propagating in Africa for several years. But since last year, at the end of the year, there were a mutation, and the new strain, CLAD 1B, is much more virulent and much more contagious. And what was the average of what happened in 2022 of a case fatality rate of 22% now has jumped to 3% on average. And then for children, pregnant women, immunosuppressed patients, it might be up to 5%. That's pretty high. So taking that into consideration, the best way to stop an epidemic to become a pandemic is to fight it at its core. It's where cases is happening. And cases are happening right now in Africa, in East Africa and Central Africa. There's about more than 17,000 cases in 13 countries, but most of the cases are concentrated in the Democratic Republic of Congo, which is about 15,000 cases and 537 deaths. So we have a little bit more than 3%. So if we want to prevent a pandemic, we need to fight it where it's happening. It's in Africa. So this is where it's a political choice to some extent to prevent that to happen and to come to us. It's the same thing. It's when you want to fight a fire, you run into the burning building.
I really want to emphasize that point you just said, that if we as a nation, we as a global community want to prevent another pandemic, and I think we all do because we don't want to live through that again, we need to get the resources where they are most badly needed. You're arguing also that it's not just about getting the vaccines there, but that Canada needs to make a monetary commitment as well. Where is money required in this fight against mpox?
Well, there's several things that needs to be supported, but most of the time what happens is there's a procurement. So countries need to get vaccine, but it's not only getting vaccine, and we've seen it with COVID-19. It's not because you have vaccine that people are going to line up and want to get vaccine. We need to do what we call communication, education, and campaign awareness about how to tackle this mpox. And then there's some behavioral changes that needs to happen, and there's some protection that needs to happen. So this is what we need to finance, is the surge to get vaccine, and after that to deploy and deliver vaccine up to the arms of people.
What kind of reaction are you seeing from the provincial governments, from the medical community, from the Canadian government about this call?
So far, we haven't heard anything. So we hope that this is going to be helpful as an interview to get some reaction.
Okay, we hope you get that reaction. Before I let you go, Dr. Liu, let me ask you about the general public. And it's very hard to get a read on how people are feeling about mpox because the experience of COVID was so scarring for so many. And it turned many people away from medical warnings. All of a sudden, you've seen it, we've seen it, this deep distrust in institutions like the government and legacy media and even science. The things that we thought we could trust and were true, people aren't trusting them as deeply anymore. And I wonder if you're worried that mpox is going to fall through the cracks because of this lack of trust.
I think that trust is an issue, and it's a world issue right now. But I believe that people would be able to discern and make their own judgment. And I think that I do understand the collective trauma that we went through with COVID-19, and no one wants to go back to lockdown and to be quarantined. And if we want to avoid that, it's exactly what we need to do, is to go and fight it where it's happening. So that's what we need to do. And the thing is, we have to understand that the mode of transmission, as you said at the beginning, it's through close contact. So it is not in the air, as was COVID-19. And so therefore, through behavior, through caution, this should be able to be contained fairly quickly if we do the right thing. So I think that we will not go to those lockdowns. We should not do travel bans, not at this stage. If we are fast enough to basically control this in Africa.
Okay, if we do the right thing. Dr. Joanne Liu, thank you very much for your time today.
Thank you.